Welcome to KidzDocTalk with Dr. Jennie. Today's guest is Dr. Habet talking about ADHD. Dr. Habet completed medical school at the University of the West Indies in Trinidad and Tobago. She completed her pediatric residency at Jackson Memorial Medical Center and Old Children's Hospital with affiliation at the University of Miami. She's board certified by the American Board of Pediatrics and sits on the General Pediatrics Examination Committee for the ABP. Dr. Habet has been part of the Pediatric Associates family since August of 2016 and is currently the lead physician at the brand new Bartram office. Dr. Habet has lived in St. John's for the last 5 years with her husband and two beautiful children. They love the outdoors and spent time at the beach, hiking, biking, and lots of time on the soccer field. Welcome, Dr. Habet.
Welcome to KidzDocTalk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the Director of Telemedicine at Pediatric Associates.
Hi, Dr. Habet. Thank you so much for joining us.
Hi, Dr. Berkovich. How are you?
I am good. I'm excited to talk about ADHD. I think it's super relevant. I think it's always relevant, but now especially since we're seeing so many consequences, so many mental health consequences in kids. I think it's becoming a little bit more of a topic that people are interested in. So I'm happy to talk to you about this. But before we jump in, tell us a little bit about what ADHD actually is, because I know there's different types and sometimes it can get confusing.
Sure. And you know what? It's definitely a diagnosis that's really hard to just say in one sentence. If you ask me, what is diabetes? What is asthma? It's linked to just one organ. And it's kind of really easy to answer, just in one sentence. ADHD is a little bit more difficult. And so I'm going to try to sum that up. But I think what the gist of it is that it is actually a neurobehavioral disorder. It's the most common neurobehavioral disorder of childhood. I think just knowing for people to know that it actually is. There's a criteria. There's a diagnostic criteria that's out there that we can talk about later that speaks about children having difficulties in academic achievement as well as their well-being and their social interaction. So it's exactly kind of what the name says, right? An attention deficit, not having issues with attention and focus, and or as well as hyperactivity. So it is kind of what the name is, but there is an actual criteria that we go by using those signs and symptoms that we just mentioned, different types of inattention and focus, signs and symptoms, different types of or signs and symptoms of hyperactivity. And if those signs and symptoms are present in two different environments. So, we have moms saying that I see these issues at home. I have teachers saying that I see these issues at school. If it's present in two different environments, that's kind of where we start forming that diagnosis. Right, so it's the inattention deficit, focus issues, behavioral in two different environments, and that's kind of where the diagnosis starts to stem. I think what's really important, just like you mentioned, we've come a long way. There's so many studies, so much research that's being done now. That's another part of the diagnosis is that it is actually we've mapped the brain, we've done imaging and MRIs. Looking at patients who have ADHD, and they've actually seen that there is an imbalance of our neurotransmitters in our brain. So there is an actual physical issue in the brain, and so that dysregulation of our hormones in our brain, and they've even mapped that there is a delay or what's the word of growth of the frontal cortex of the front part of the brain. So there's an actual signs and symptoms of ADHD, but there's actually something going on in your brain, and I think that's really important to kind of say about what ADHD is.
Thank you. I think that's critical because I think a lot of parents are hesitant, and we'll talk more about this, right? Hesitant to really accept this as a diagnosis. They feel a little bit uneasy having this as a true diagnosis. Sometimes they feel like maybe this is just normal routine behavior. This is just a really active kid, and the teacher can't handle it, or like the other parent can't handle it, that everything is fine. And I think it's really important that when we bring this diagnosis into question, it's coming from a place of true diagnostic criteria. We know there's something truly wrong, and it's not
Absolutely.
any different, right, than asthma or diabetes, right?
Absolutely.
It's really, it's a
Absolutely.
disorder like everything else.
Yes, exactly. I think that's the point to get across, and treating it that way, right? That, this is not child's fault. This is not something that you did wrong, mom. This is not because the teacher's failing. That this is truly real. This is really something that we may not be able to control, and treating them accordingly, just like we would treat an asthmatic who needs, something for their lungs, or you treat the diabetic that needs insulin for their sugar.
Fantastic. Yeah, that's a really great analogy. I think we'll keep coming back to that because I think it's a really, really important point.
Mm-hmm.
So in that same kind of line, how can we tell the difference between like routine normal, maybe a kid that's a little bit more hyper, a little bit more active, and is there a minimum age? Because right, we see a lot of 2 and 3-year-olds that are bouncing off the wall, and are those kids, do they have ADHD? Probably not, right? So what are some kind of like red flags for us to stop, for us and for parents to stop and say, I think there might be something wrong?
Great question. And you're right. And currently the American Academy of Pediatrics, like you said, because we know that there's a normalcy of behavior in our 2 and 3-year-olds, they've really kind of linked the diagnosis to 4 and over. And again, not to say that there may not be some signs and symptoms that you're already seeing of ADHD, but because we have a full criterion, it's kind of hard in a developing brain. This child is still developing. We're not going to throw out this diagnosis. They might have some hyperactivity, and we may have to help out with that. There may be some behavioral issues, and let's work on that. But as far as the diagnosis is concerned, we really give that diagnosis after assessing a child that's about 4, we'd say pre-K age. So it's really within that pre-K age of 4. And just like I said before, exactly that, I'm great at home, but I act out at school only. Okay, well, let's explore that. Oh, then I've realized, oh my gosh, my kid was being bullied. That's why I was acting out at school. And so really, like you said, when do I start getting concerned? It's really when you see that in every environment that my child seems to be struggling socially, struggling academically, struggling with behavior, and it's at grandma and grandpa's house, it's at home, it's in school. And I think one big red flag, which is really dear to my heart, I feel, is just being a pediatrician and sitting in a room, is when you see that this is affecting their quality of life, right? They're the bad kid. They're always yelled at. You start seeing them lose their self-esteem. They don't feel like they're good enough. They don't feel like they're capable of because I just can't do it, right? I'm always the hyper. I'm always the one who told to sit down. I can't finish my work. And I think, so as you said, red flags, I think when you start seeing that your child is really, their quality of life is being affected in all areas of their life, that's when you should say, all right, you know what? I think I need to get some help here.
I think that's really important. And to come back to the idea that it's not anybody's fault. It's not that they're like naughty, right? Or they're the bad kid, or they're trying to do something on purpose, or we're failing as parents or as educators. It's really a true disorder. And we have to look at it and treat it as such, right? And I think that's really helpful for the kids to hear also, that we don't think that they're bad, or that they're doing anything that is their fault necessarily.
Absolutely.
A question that I get a lot that I think I really struggle with is this like a forever diagnosis, or is this something that we can look forward to maybe growing out of, or even medication, right? Once we start medication, is medication forever? What are your thoughts on that?
Sure, and it is definitely a common question. I get that question a lot as well. And to be honest, if I'm just going to be really straightforward, I would say the answer is no, it's not something you grow out of. This is something that is diagnosed in childhood and carries out through adulthood. However, your signs and symptoms change because you grow and you mature. So while the elementary school age child, middle school age, I would say 6 to 12 may have a lot of hyperactive symptoms, right? Unable to control themselves. All right, my frontal cortex isn't fully developed. I still haven't learned coping mechanisms. And so while you might see more of a hyperactive kid at that age, as I get into my adolescence stage, right, I've learned to adapt. I know it's a little bit more of what's right and wrong, and that even if I may feel a little hyper, I know how to control it. You learn coping mechanisms, but in the adolescent age, you'll see more of the inattention. Right? I'm still having issues with focusing, following through, completing my tasks. And then adolescent to adult is when we get to still having issues with attention, right? And statistics show that a lot of our adolescents and adults with ADHD get into more car accidents. Having vehicle pedestrian accidents because they weren't paying attention. And so while you never grow out of it, you do see, you do struggle with different things, and you do adapt as you get older. Some things get better, and some things you have to work on differently, depending on the stage that you're at.
I think that's good. I think it's important to hear that there's sort of not necessarily a light at the end of the tunnel, but definitely a progression. And I find that kids with ADHD tend to be very bright. And so I always reassure parents, right? There's a compensation component. They're going to be able to, right, overcome pieces of this. We have to help and support them with the other pieces, but we don't want them to keep struggling forever and ever. And so I think that brings me to treatment. And so, treatment is challenging to talk about with ADHD. Parents, I find that often are hesitant or nervous to start medication. And I often get questions about what else can we do, right? I know he has ADHD. I'm on board with the diagnosis. I'm not on board with the medication yet. Are there other non-medicine, right, non-pharmacologic treatments that we can offer?
Right, you're hitting some good points. Absolutely, and again, I talk a little bit about recommendations because that's what we do, right? As physicians, as our primary care pediatricians, we do kind of look at what recommendations are given to us by the specialists, and so absolutely, we actually in the pre-K I taught before, in that pre-K, 4 to 6 year old age range, the number one treatment modality is behavioral therapy, behavioral modification therapy, adapting schools, speaking to the schools and getting, adaptations within the school for that child. So actually medication is not the number one treatment in that age group. And when I say behavioral therapy, it's even behavioral, there's something called PTBM. It's parental therapy behavioral modifications, right? Even therapy for the parent, learning how do I cope with this kid who's a little different? How do because if I retaliate and if I react negatively, then my child is even worse. And so there's a lot in that 4 to 6 year old age range that is actually recommended to do that parental behavioral modification therapy, and positive reinforcement therapies, things like that, and then modifying in the school, right? Speaking with whoever, the teachers and assistants, and trying to cater for that child and see how can I bring out the best in this kid, even though I may, have some of those hyperactive nature. As you get a little older, however, not that those things don't work, and not that it's still not, we still do definitely recommend that there are accommodations in the school to help things like, I'm sure you guys have heard before, things like a 504 plan, an individual educational plan, things that can cater to help that kid to have a longer test taking time, maybe being pulled out to have more one-on-one attention so that they can, because they just need to focus, and they can't focus in a classroom of 40 kids. So while those things are still recommended into the middle school and adolescent age, like I said before, because it is a neurotransmitter dysregulation, because we do see that there is a problem with our cortical pathways, I just can't focus if that area of my brain is not working. And that's where medication comes in. And that's why we feel like it's a multidisciplinary modality. Like we can help kids in many ways, but medication really does help because we've found out that there is an issue here in my brain. And you made a good point, and it really is, no one treatment works for the same kid. It's really being, what can we do to make this kid be the best kid they can be? What can we do to help this child reach their potential? What can we do to make this child thrive? And in essence, that's the answer. It may be one thing, it may be two, it may be the school and medicine, but in the end, it is doing what we can to get the ultimate result. And it is to have a child that thrives and feels good about themselves and confident. And I think in essence, that's really, how I see it and how we should see it as parents and providers and teachers.
So you touched on something I think is really important, in that getting the school involved and getting their support and seeing what resources are available. I find that some families don't necessarily want to do that, or they're hesitant to let the school know. They say, I don't want them to know. I don't want my child to be labeled, right? I don't want this in their file. And we do a huge disservice when we leave the school out of it, because as you keep mentioning, the diagnosis exists across all environments. You don't just have ADHD at home, or you don't just have it when you're doing homework or with your friends, or you don't just have it in school, it's in the family as well. So everybody really has to be on board, because it affects all areas of the kid's life.
Absolutely. Truly believe in that.
So a lot of parents will bring me articles, or they have questions about like natural remedies, right? Like people will want to stop sugars or artificial sweeteners, or gluten, or add vitamins, things like that. I haven't seen any truly compelling evidence that is helpful, but some parents really swear by it. What has your experience been with that kind of approach?
I agree. I have not read or seen any true evidence towards that as well. And it's not that they haven't tried. They've really looked to see, but they haven't found anything that's linked. What I usually say is, listen, we haven't touched this yet, but there are other things. ADHD is not the only thing that your child may have. And there may be other comorbidities. There may be other things that are going on with a child. So if you decided that I'm going to take out gluten and I saw a difference in my child, well, maybe there is something else that the gluten is helping with, right? Or if you feel that, I always tell people, if you're not hurting your child and you feel that if I do an elimination diet and I remove something and my child seems to be better, then it's okay. But is it truly a cure, or the only thing I could do for ADHD? Probably not, right? And that's kind of how I see it. That if you feel you do something that makes your child thrive better, sure, but definitely not linked to the treatment of ADHD.
I think that's important, right? Yeah, and I would agree. I never discourage it, but I'm always hesitant to promote it as the sole treatment, because I think ultimately, right, in true ADHD, if that's what we're dealing with and that's what we're struggling with, we're probably going to need some medication, at least for a period of time. So I talk a lot about families that are hesitant. Tell me what you've seen. What are some hesitations? What are reasons that parents are not on board? I don't have the same problem with getting kids who have asthma to agree to an inhaler, but ADHD seems to have some sort of stigma with it. So what is it that you've seen, and how can we kind of work around it?
Yes, I would say the biggest stigma I've seen is I don't want to put my kid on a medication that they're going to get addicted to. That's probably number one. Yeah. So, and we'll talk about that. So, thinking that we're using addictive medications. I think there are some, and with all concern, I understand. I don't want to put my kid on a medication that's going to change who they are. I don't want them to be a zombie. I don't want to change who my child is. And then again, the third one is really the hesitation, is that I don't understand why I'm putting my kid on a medication because they don't behave right. Mm-hmm. And so to address those, it is, and we've come a long way, just like we have in many different avenues of medicine, that perhaps when medications did first come out for ADHD, there was only one option. And because there was only one option, that one option did not work for everyone. And so there may have been more side effects in kids then, but we have come a long way, and there are different options for different kids. And I think the number one thing I wanted to bring out is that anything that is taken, prescribed, and done the right way, if a medication is done in that manner, then no, it's not going to be addictive, right? You can take anything and make it an addictive drug, right? We hear about adolescents going to pharmacies and buying Benadryl and drinking a bottle of Benadryl. So our goal as primary care providers is to provide the least amount of medication to have the best effect. And so we start slow and we move up, right? We start on the lowest dose of medication. We watch for side effects, and so that's number one, right? So the least amount of medication can give the most effect. And actually, it's not been linked to any type of addiction if taken the right way. It's actually the opposite.
Mm-hmm.
Kids and adolescents who are not being treated for ADHD, right, who then start to feel anxiety and become depressed because they can't live up to the expectations in front of them because they're different than everybody else in school, they start reaching out to substance abuse, right? You become this adult who, I dropped out of school, I never reached my potential, now I don't have a job. So really and truly long term, there's more of a risk of getting into drug use and getting into violent behaviors, things like that. If treatment's not there, right? Treating now and having a child with great self-esteem, right, and being productive and reaching your goals is actually better to start now and not develop those bad habits in the future. So that's kind of what I usually tell my parents. Am I going on a tangent there?
No, but that's good. That's good. I think that's important because a lot of people will tell me like, listen, I get it, right? He has ADHD, but he's doing well. Like school's going fine. Teachers don't really have complaints. Like I can handle, that's the other thing that especially moms, they love to tell me like, I can handle him at home. I know how to deal with him. He doesn't need medication. But there's a lot of benefit to treating, or rather there's a huge disadvantage to leaving these kids untreated, even if they're extremely bright and compensating and doing relatively well otherwise.
No, absolutely. There's a good book written by Larry Silver. He's a physician, and it's called The Misunderstood Child. And I read that book a couple years ago, and it speaks about that. It's that, the kids who feel different struggle to explain the way they feel. Okay. And so you think it's okay. And you feel like we're compensating, but truly, there may be an internal struggle, and you think that but do we just want to compensate or do we want to thrive?
Right.
And
that's what I see, right? When the kids, when they're being treated, and that's always an indication for me that we're like on the right track. And we'll talk more about this, but like how do we know when we're treating right? It's when I see the kid being successful. It's when I see them reach their full potential. And the older kids will tell me themselves, like, I feel different. I can tell when I'm on it. The self-esteem is higher, right? And all the things that we talk about, substance abuse and all that kind of risky behavior becomes much, much less likely.
Absolutely. We do like a happy dance. It's great. It makes my heart just go up, right? Like I'm like,
I love it. Yes.
You have 8 on a roll. What? Let's do that.
It's a big deal. It's a big deal.
Yes, it really is. It really is. And you see that child blossom, and it's really a great thing. And you really don't want to not have that. You want to look back 10 years from now and say, wow, I did everything I could, and look at my kid, they're really thriving because we did what we had to do to not have them have that internal struggle.
For sure. So listen, for sure there's a huge benefit and there's advantages to treating, but no medication is without side effects, even Benadryl. So what are some common side effects, and what are things that we watch for to make sure that we're titrating or we're giving the appropriate dose?
Absolutely. If you talk about the most common, the number one things on the list is we do see some appetite suppression initially, but we advise against that. We said, if you always take your medication after you have breakfast, right? So you may not have appetite, so then you get a great breakfast in. You might have a small lunch, and then medications wear off by dinner time. You have a big dinner, you have a late snack, and so yes, the number one side effect is some appetite suppression, and again, we do look for that. That's why we monitor our weight. We make sure that, if there is some weight loss, it's not significant. And usually, like I said, with parents, they can compensate, right? Having good breakfast, big dinners, little snacks in between, and usually you can compensate for that. Number 2 is you do sometimes have some abdominal pain initially when taking the medication. From my experience, I feel that for the most part, it tends to go away. Usually something that's initial when the medication is started. Things like headaches can be, again, And a lot of this, I will be honest, are things that I see initially with the start of the medication, and do things that I do see that go away over time. What we do monitor as clinicians, number one, we talked about the weight. The reason why we have frequent follow-ups, and usually just to make it clear, we do 3 monthly follow-ups, is because there is a small effect on the heart rate and the blood pressure. But it really is small. Studies show that your heart rate can be affected by 1 to 4 beats per minute. Okay, your blood pressure also can be affected by 1 to 4 mmHg. So not horrible. So for the most part, and of course, if it goes to a level that we're uncomfortable with, then that might not be the right medication for this child. Not because it's working, but because we do not want to cause harm. And that's what I tell parents too. We're here to ensure that we're not causing harm. We're here to benefit. And so if there's anything that we see that might be negatively affecting that child, then it may be something that we'll have to remove and try something else. But I would say those would be most common side effects you'd see at home and the things that we would monitor for in the clinic.
Fantastic. Yes, I would agree. I've seen similar things, and oftentimes it's just a matter of waiting a little bit longer, or sometimes making a change to a different type of medication. And we have that luxury now, right? It used to be,
Absolutely.
like you said, there was only one. And so sometimes families are hesitant to start treatment because they themselves remember being on that one medicine, right? 10, 15, even 20 years ago. And they feel like they didn't do well on it. And so that's their experience. But we really have many, many more options right now.
Good point. I do see that as well.
So how do we know that we're on the right medication, right? We mentioned that the kid's going to feel better, right? They're going to be successful, self-esteem is higher, but what are like some indications for you that like we titrated correctly, we're on the right dose, we're on the right med, smooth sailing from here?
So I think that, yes, not just hearing from the child or hearing from mom, but it's the repetitive assessments from the environment that the child is in as well, right? So getting that feedback from the teacher, getting that feedback from the school psychologist, getting that feedback, asking for tangible things. We have some forms. There's something called the Vanderbilt form that we use, that we use for follow-ups, just because it's more concrete, right? That they're actually check mark questions. And I can say, wow, let's compare this to the last time you were here. What a big difference, right? All the things you've improved on. So I think there are some tangible markers out there that we do use. I would say that's number one. And the biggest thing, of course, we just mentioned is just seeing that success, right? Seeing these kids, whether it's academically or socially, seeing that. But one of the other things I want to say too is sometimes there are some comorbid symptoms that go along. So kids who have ADHD may also have some signs of depression. Kids who have ADHD may also have some signs of anxiety, oppositional defiance disorder, some conduct issues. And we've actually seen that treating the ADHD, because one might have led to the other, or, treating the ADHD, you see these other comorbidities get better. They're not as anxious. They're not as depressed. You see that our behavior has improved. And so I think even that as well, where there are other things on the list that maybe they're working on, those things tend to improve as well at times. So just looking at the overall symptom change.
I think that's important. I think it's important to remember that ADHD sometimes does not exist in a vacuum. And so actually one of my mentors who does a lot of ADHD management, he always tells me, like, stop and ask yourself, like, what else is there? Convince yourself that ADHD is that's the only thing, because a lot of times we do need some additional support to address maybe other things that are going on. So in that same vein, what are things that families can do, right? Let's say now we've transitioned. We've got the diagnosis and we've accepted the diagnosis. We're being treated. We've accepted the fact that this is the right thing for the child. What else can families or educators do in the home or at school to really make it a supportive environment for a child with ADHD?
I think number one is education, like you said. So educating yourself and saying that, let me try to understand. Okay, now I've got the diagnosis, but now I have to understand, right? Now I have to understand what my kid's going through. So like I said, I don't have a child with ADHD, but because I treat children with ADHD, I've gone and I've read so many books, not medical books, just books on, how to parent a child with ADHD, because I want to have that understanding. I want to be able to relate to that child when they come in and not feel like I'm one of those other people that's coming down on them. So I want to say things like, going to resources, Googling, there's so many websites for parents with kids for ADHD, finding some good books. And I have some recommendations I can always get at the end of books that I can read to help to understand. Thirdly is that communication. All right, now I realize it's not just me. So having that communication with the teacher, so teacher with the mom with the teacher, with the school psychologist, frequent follow-ups, it's a team approach. And like going back to what you said before, right? A child with a chronic health condition has a team, has a pediatrician and a specialist and a nutritionist and everybody involved. And that's how I want the world to see ADHD. This is a chronic medical condition that requires a team. And I think it's that communication between the team saying, I need to make sure that we always communicate. And that way we're all on the same page for my child, for this child.
I think that's very helpful. Super concrete. We did a lot of coverage today, so I'm excited. I feel like we can talk about this for forever. There's a lot to be said. So let's try to like sum it up. What are some like major takeaways or what are things that you really want to make sure parents walk away from this kind of understanding about ADHD?
I think a good takeaway message is that pay attention, we're not paying attention to those cues, paying attention to not just to the academic side of your kid, your social, the social aspect of my child, and really looking to see, do I think that my kid's thriving? Do I think that they're happy? Do I think that that they're reaching the potential that the teacher says they have, that I know they have? And if I feel like we're struggling, don't feel like you're alone, right? This is not something you did wrong. This is not because I failed as a parent. This is not because he doesn't have a good teacher. If we feel like time and time again, I feel like my kid, I just can't get my hands around getting us to thrive like the others, then reaching out to the school, reaching out to your primary care pediatrician, and saying, all right, I think that there's something that's just not right here, and I really want my kid to thrive and be the best they can be, and not feeling hesitant and not feeling ashamed and not feeling that because I have a kid that does not have the best behavior, that is because of them or because I didn't raise them right, or I'm blaming my spouse. Just seeing it as maybe I need to reach out, and maybe that there's some help for me out there. And in essence, I can help my child to be amazing and to be in the Hall of Fame.
Excellent. Well, listen, thank you so much. Really appreciate this conversation and hopefully some excellent learning points.
Thank you. Thanks for having me. It was really great talking about this topic.